Hello, my NTSAD friends. I'm sorry I couldn't be with you for the 47th annual conference. Our 2025 legislative session is in full swing in Tallahassee, and we're often working through the weekends. While I couldn't be with you there in person, I wanted to join you virtually and share some of the progress that we're making here in Florida for families that are affected by rare diseases. But before I get into that, I'd like to take a minute and just share a little bit about how our family got here and why the work that we're doing here in Florida is so personal to us. My wife Brianne and I are blessed with three beautiful children. Our daughter Kaylee is 15, Julie just turned 13, and our beloved son Andrew would be turning 10 this August. Drew was born on August 10th, 2015. When he was born, our family was complete. At the time, no one knew his body was unable to produce the level of the hex A enzyme he needed to survive. Like most children born with Tay-Sachs, he was delivered in an uneventful birth and developed as any other child would for several months. He was happy, he was playful, and he was perfect in every visible way. When Drew was about 6 months old, Brianne noticed something wasn't quite right. At the time, I didn't believe her, and unfortunately, neither did his doctors. Mothers tend to know these things much more than fathers do, at least that's been my experience. When he was about 9 months old, we noticed some undeniable regression and started seeking the advice of new physicians and specialists. But it wasn't until around his first birthday when our doctors started to listen. Like so many of you, we went through a very frustrating period of traveling all over the region, receiving testing that produced no answers, and we received one misdiagnosis after the next. When Drew was 15 months old, we finally fought for genetic testing, and we got the definitive news that no one ever wants to hear. Drew had infantile Tay-Sachs disease. Since his diagnosis, Brianne and I made it our mission to do everything in our power to ensure that other families don't have to live that same heartache that we did. We spent the next few years entrenched in research, meeting with scientists from across the country and even internationally, trying to learn everything that we could and searching for the promise and the hope of a gene therapy that could be a cure. Brianne became very active with the Cure Tay-Sachs Foundation, where she still serves on the board, and she worked closely with the gene therapy company Axivant, where she served on their patient advisory board. The mama bear in her somehow gave her the strength to do all this when I was still in shock and disbelief. At the time, I simply didn't have the mental capacity to do much more than simply care for our sweet boy. And his health continued to decline, and then the seizures set in. Drew took his last breaths when we held him in our arms on December 22nd, 2019. Trying to be the best parents that we could for our girls, we still hosted Christmas at our house a few days later. Not long after that, I decided to run for office, and I won my first election to the Florida House, where I quickly realized the tremendous opportunity God had given me to advocate for other families that are affected by rare diseases. I almost immediately began building key relationships in the healthcare policy area, and I began advocating for supporting rare disease research, expanding access to genetic testing, and insurance coverage for gene therapies. Some of the first bills that I passed when I got to Tallahassee established a grant program to fund rapid whole genome sequencing for children in a NICU setting, and a pediatric rare disease research grant program to support universities working on cures for rare genetic disorders. Both of these programs were later codified into statute and currently bear Andrew's name. In its first year, the research program received over $8.5 million in funding requests, which really demonstrated the strong demand for this type of funding. That demand exists not just here in Florida, but across the nation and even the world. We also passed legislation that allows parents and caregivers of medically fragile children to be compensated by home health care agencies. So many of us rely on this care, and this new law helps recognize the enormous role that parents already play. A major initiative that I've been working on is the brand new, first of its kind, Florida Institute for Pediatric Rare Diseases. This new institute is at Florida State University. It was officially launched last year. The institute includes a CLIA-certified genomics lab, a master's program for genetic counselors, and the institute is already conducting 23 ongoing rare disease research initiatives, including next generation AAV vectors and a state-of-the-art viral vector and genomic editing facility. The next step is to build out a full-service pediatric rare disease clinical health center that will serve as a destination to diagnose and treat children with rare diseases. Finally, just last week, my Sunshine Genetics Act was passed off the House floor with unanimous bipartisan approval. This transformative initiative will help us end the diagnostic odyssey in Florida by providing parents with the opportunity for whole genome sequencing at birth free of charge. This testing has the ability to diagnose as many as 600 conditions that have actionable treatments, and it provides a pathway to connect parents of children with positive test results to institutions and researchers. And we know that early treatment saves lives, so it's critical that we make this connection. The Sunshine Genetics Act also establishes a national consortium of universities, children's hospitals, and industry experts to coordinate and collaborate the research on pediatric rare diseases. The best possible outcomes are produced when we all work together. Thank you for taking the time to send some of the questions that you had for me in advance. I'm going to answer as many of those as I can right now. And I have Grace here with us. Fortunately, you're not going to be able to see her, but she'll go ahead and read those questions. I'll do my best to answer every single one of them.
Question 1. How did you get buy-in from lawmakers in Florida to provide funding for the Florida Institute for Pediatric Rare Diseases at FSU and the Sunshine Genetics Act? Did you focus on the Medicaid cost savings associated with early detection or the patient impact of saving lives?
That's a really great question. And I think it's important to note that all of these initiatives have really been a multi-year effort to get them to where they are right now. And the work is ongoing. It continues today. It's about becoming a leader in the area. It's about educating other lawmakers, key decision makers about the issues that our community faces. And it's not that other lawmakers don't care. It's just often the case that they don't know. So education really is key. In the case of the Institute, it was also about finding the right university to lead the initiative, one that shared the same vision that I had, and one that realized the opportunity that it presented to lead the nation. Florida is a very fiscally conservative state with an increasingly tight budget. So we're also a state with a very high Medicaid population. Half of the babies born in Florida are paid by our Medicaid system. So educating other lawmakers about the cost savings with early detection was really important with getting the Sunshine Genetics program across the finish line.
How can our community use what you learned to create a blueprint for similar legislation like the Sunshine Genetics Act in other states?
I've learned a lot in this process. 3 years ago, I was a political outsider. I was a simple small business owner. But I believe that focusing advocacy efforts on state government can be much more productive than on the federal government. State leaders are typically much more accessible, and they have the ability to enact policy much more quickly, much more efficiently than the federal lawmakers often do. When it comes to rare disease policy in Florida, I have the blueprint, and I'm happy to share that anytime. My door is always open, and I'm eager to help other states adopt similar policies.
Question 3. Can people like us who don't work in the world of laws but do have unique personal experiences really make a difference? What can we do to help?
Absolutely, 100%. I know personally how difficult it can be to do it, but the simplest way is to simply tell your personal story. Moms tend to do a much better job at this than dads. At least that's my own personal experience. But I've lost track of how many times I've publicly shared our family story. Unfortunately, it never gets easier, but I don't think there's anything more impactful and more effective than providing the context and education from your own personal experience, your own personal rare disease journey. When policy is being considered in our state governments and in the federal government, there's committee meetings and they're open to the public. They're open to the public for public testimony. Go to them, share your story with lawmakers. They want to hear from you. Their job is to represent you. You elect them to do that. Your opinion and your experiences do matter.
Question 4. How can nonprofits, patient advocacy organizations, and individuals help to build bipartisan consensus to address the identified needs of our community and engage in advocacy?
Another great question. Mobilize your groups, speak out publicly, testify at committee meetings in the government, reach out to your state and federal representatives and your senators. You can do this individually, but the most powerful way to do it is when you get together and work collectively as an organization. Some of us aren't comfortable being public, so letters of support or letters of concern to your lawmakers are also a very good way to do it. The more that lawmakers receive, the more likely they are to pay attention. This has been a challenge for me personally as we've been working on this rare disease policy over the last couple of years. We had a number of individuals who have been very outspoken, very supportive. But when we put out calls to most of the national rare disease organizations, they decided not to collectively support our work. This has been kind of frustrating, but I believe that it's a squandered opportunity. So organizations really do have a unique opportunity to advocate collectively, and I would challenge you to do exactly that. You can make a difference.
Question 5. With the expected federal cuts to Medicaid, what should state lawmakers do to prepare to meet the needs of the millions of the people affected, especially children?
Well, when it comes to Medicaid, the percent of federal Medicaid funding varies state by state. It also varies year to year. In Florida, it's roughly around 60% of the total Medicaid spending. But states have the ability and also the responsibility to cover the balance. And many have to adjust their budgets accordingly. States also have the ability to adjust the current programs that they have that are operating in the state, and they have the ability to add new ones.
Question 6. How do you foresee the recent NIH cuts affecting your state? What can state officials do to ensure that critical funding will still be accessible in their state so that scientists can continue to work on rare disease research that will give families hope?
The reality is there's a lot of waste and abuse in our universities and with NIH funding. It's unfortunate, but true. And anytime there's a change to a system that we've become accustomed to, there's going to be some concern, and institutions are going to have to make some hard decisions. Those that use a high percentage of NIH funding for actual research are going to be affected much less than those that don't. Many medical school deans in Florida are looking at this actually as an opportunity right now because their overhead and administration costs are a lot lower than some of the other universities in other states. But what's important to note is that states have the ability to step in. They have the ability to fund their own research institutions, and that's exactly what we're doing in Florida. That's what we're doing at the Florida Institute for Pediatric Rare Diseases. That's what we're doing with the Sunshine Genetics Act. And that's what we're doing with the Pediatric Rare Disease Grant Program. So other states have the same abilities that we do here in Florida. We just need to find folks that can pioneer these initiatives.
Question 7. What can state officials do to advocate on federal issues like the Rare Pediatric Disease Priority Review Program? And what can they do to ensure that policies are put in place to support rare disease research at the state level?
States can and should establish their own policies and grant programs to support research in their own states and at their state universities. Universities can partner with principal investigators in other states, and it's simply a matter of getting state lawmakers to prioritize these kinds of issues in the budget. And you can advocate for that. You can advocate that for that with your state senators, with your state representatives or assemblymen. They want to hear from you on these issues. So again, I really encourage you to get to know your local representatives.
Question 8. What can state officials in Florida do to support newborn screening and or do to urge the feds to bring back the ACH DNC and support RUSP?
Every state runs its own newborn screening program. Most states currently rely on the RUSP to decide which conditions they're screened for at birth, but they have their own state newborn screening advisory committees. And those are the folks that actually make the decisions on what to add to the newborn screening panel. Typically, states wait for a condition to be added to the RUSP before they act. And then from there, it can take many months or even several years before it's actually added to a state's newborn screening panel. So it really is not a great process. But what's important to know is that states have the ability to completely bypass this process with their own legislation. And we're actually doing this in Florida right now with Duchenne muscular dystrophy. This is a condition that has 8 FDA approved treatments. There's dozens of clinical trials. Actually, I think there's over 65 clinical trials going on right now. There's dozens of treatments that are in development from dozens of different biotech and gene therapy companies. So there's a lot of energy. There's a lot of funding going into Duchenne muscular dystrophy. And we decided in Florida that we're not going to wait for the federal government to act and add it to RUSP. And I'm proud to actually be co-sponsoring legislation right now that's moving through the Florida House that will bypass that system completely and add Duchenne muscular dystrophy to our state newborn screening panel with legislation. So that's a possibility that exists in every state. Again, something that you can advocate for in your state.
Question 9. Many states have community based services and waivers for children with life limiting illnesses. If such services were significantly cut, these children would likely have more visits to hospitals and increase healthcare costs. What can policymakers do to move these policies forward?
This comes down to education and advocacy from our community. We need to let our voices be heard by policymakers. We need to ensure that they see and realize the impact these programs have, not just on our community, not just on our families, but also on our society as a whole. Contact your local elected officials, tell your story to them, tell them about your personal experiences, and tell them about a study that was conducted by the Every Life Foundation. This was really landmark research that was done in 2019 that found that the economic burden of rare diseases nationally was almost $1 trillion. And half of those expenses were direct medical expenses. I'd be happy to provide that information to anyone here if you reach out to my office, if you don't have it already. It's really amazing research that was done, and it really tells the full economic story of the impact rare diseases have. Well, thank you all so much for your questions. In closing, I just want to tell you that when I was first elected, I was really surprised to see how little the rare disease community was represented in government. And while there's some cutting edge biotech companies, gene therapy firms, and great research universities and nonprofits like NTSAD and the Cure Tay-Sachs Foundation, the industry is quite fragmented. And with over 30 million people affected by rare diseases nationally, that's almost 10% of our population. I see this as a big opportunity to unite and advocate together. Organizations like NTSAD provide a valuable support structure for families like ours. But if we work together, we can make a real and lasting difference for our kids and for the next generation. Together, we can cure Tay-Sachs disease, Canavan, GM1, and Sanofi disease. I want you to know that you don't have to run for office to make a difference. I encourage you to work closely with researchers, host fundraisers, support the work that they're doing. Petition your state representatives, your senators, and your governor. Ask them to focus on state initiatives like we're doing here in Florida. Talk to them about participating in the Sunshine Genetics Act, the Sunshine Genetics Program. Talk to them about establishing a state rare disease advisory council and volunteer to serve on that council. If you have questions about how to get this done, I'm here for you. My team is here for you. My office and my door is always open to my NTSAD family. Thank you for everything that you do. Thank you for fighting to bring hope to others. And thank you for giving me the opportunity to join you today. I'm inspired by what the future holds, and I look forward to working with all of you to make this vision a reality.